We have discussed for the last 10 minutes some of the areas this patient is most concerned with, and the areas include her nasolabial folds. Whether she smiles or not, she seems to have deep folds that go down from her nose to her mouth, as well as the marionette lines and oral commissures.
And then when she puckers or, let me see a kiss, good. You could see the lines above her lip, and that bothers her as well. So today we're going to inject nasolabial lines, marionette lines, oral commissures, and the perioral lines.
We're going to use Perlane today, which has a larger average gel particle size than Restylane, and gives you a little more volume. I'm going to start injecting the nasolalar area. I'm going to use the serial puncture technique.
First injecting vertical,
and laying down just a small amount of Perlane. And then come in vertical.
And I'm injecting into the dermis first, the deep dermis. And what I want to do first is establish some support to the skin.
First, I'll inject into the superficial subcutis and then into the deeper dermis.
So we're doing a linear threading technique, and that technique is I inject, and as I withdraw, I'm injecting, because I don't want to inject into any blood vessels. Coming in from, again, doing a little cross-hatching.
Cross-hatching consists of a series of parallel linear threads, followed by a series of linear threads at right angles to the first set.
Where you're laying a little of the Perlane in small serial injections, or you are injecting in a lineal line and laying it out as you withdraw. It doesn't really make a difference. It's whatever technique you become familiar with, but with time you'll probably use all techniques. Okay, let's take a look. Perfect. Okay, so when you fill in the nasolalar area, you're going to put down probably about 1/10 of a cc to 2/10 of a cc, and then you're going to massage the area. And then important, look at the patient. Don't just inject and go down the line without looking. See if you're raising the area up, see if you're plumping out the area, and then go back into the area. So, and that's what I'm doing right now. I still could see a slight depression, so I'm going to come back into the area. Perfect. Okay, now I'm going to go down. Vertical. I'm still deep right now.
Then I will come back horizontal and will inject a little less deeply in the deep dermis.
So first lay down a small amount, a couple of tenths of a cc, lay the groundwork, coming in horizontal.
So what I'm doing now, I'm providing full correction by completely removing the line.
Important to say medial to the nasolabial line. I noticed that a lot of people, when they first start to inject, they have a tendency to inject lateral, and once you do that, you're going to actually accentuate the line.
So when you inject vertical, stay medial to the nasolabial line. When you inject horizontal, make sure as you retract and inject, you stop injecting before crossing the lateral portion of the nasolabial line. So now I'm coming in horizontal to the nasolabial line.
And now I start injecting, and I'm injecting all through the line.
As soon as I become lateral to that line, I'm ready to pull the needle out. Stop injecting.
Don't go lateral. You'll make the line worse. Do it again. Lateral. Go in. Cross that line. Retract. Inject as you pull back. Looking at the skin all the time. Good. Look at me again. Great.